So Karen is our operations team lead, Sue Hancock is our development worker, and I'm Mike. I chair the charity that operates the Selsey Care Shop. Thank you for having us today and for all the contact and support that we've had in the last 6 months. Selsey Care Shop on the High Street in an isolated community of 11,000 people offers 5 services: community information, activities that promote social interaction, carer support, around 70 voluntary carers dealing with about 20 different conditions of those they care for. We operate a developing wellbeing service in the evenings for adults, and the Dementia Action Alliance, that's why we've given that little sheet out. Inside is a history of the Alliance over the last year. We celebrated our first birthday last week. The 6 months since we were given the £5,000, which has paid for Sue's salary in large measure, has gone wonderfully well. The positives have been that we've had sufficient finance, the premises have been well prepared, talented personnel have taken the work forward, both staff and volunteers, and demand has grown and spread to 11 of the parishes to the west of us in the rural area south of the A27. Life does exist in that area. The challenges that we faced, our workload has had to be managed, and the operations team has been formed to do that. Personalities have had to be blended, and a monthly shop meeting addresses any issues. Different groups of people have needed to be blended in the same building, and from June each section will have a full-time, will have a paid member of staff, and that will greatly help that process. Maintaining an excellent service has needed a great deal of dedication and lots of partnership working, so that we are actually capping the number of activities that we run and inviting partners to develop new things that they may want to see happening. Teams of workers are creating new ways of serving, each having a group of volunteers to work with them. And the competing demands of service, relationships and growth goes on. We need to manage our work in detail in order to maximise productivity, and are planning revamped furnishings to maximise the space. We wouldn't do anything differently, and we've enjoyed the ride. Sue is going to tell us about her work with individuals.
I did a short video for our first birthday, so it's nice for you to sort of see some of the people and watch a little bit of the video, then you're not watching me, which is much better for me. We've been able to help people in a variety of ways since we had the award from the Dragons. I've now got 67 people on my books who I'm actually supporting, and I did that in a variety of ways. People come into the shop, I do a dementia drop-in on a Monday, they come in for a chat to me. I worked it out that I had 420 people that actually I've either had contact, had home visits or sent emails to them. I've got 10 members now of my men's group. 23 carers have been supported to access benefits. That might be attendance allowance or carers allowance. 2 people have been signposted to Care Watch for advice and information so they can get the help to get residential care. 10 of my people now come to the movies. I actually go down and attend and share a meal with them, catch up and check how people are managing. We have shop talk, 9 people attend for a cuppa and a chat. Befriending, I've got 9 people that are being supported with befriending visits. Good morning Selsey, that's a phone call every day. 4 of my people are now signed up to actually have a daily check to make sure that they're well. Sadly, in this process, 3 people have died, but we've been able to offer support and support for those carers. As you rightly said, carers then lose that role, and so they do need support. I've currently got one carer in hospital. One of the cared for is in hospital. Not everybody wants to engage, and 2 people cancelled the appointments. And I think that was because their needs had changed. And they were signposted to me by a social worker, and I think it was because they were at the end of the journey. A diagnosis of dementia is life-changing, therefore it's important to get timely access to support and information. Being told that you have dementia is not to just one person, it's to family and friends, and so the drop-in is really useful. Behind those facts and figures are people, and you can clearly see them, so I'm really pleased to give you just a brief case study. George's granddaughter, who is under 50, popped into the shop. Granddad's just lost his wife, lost sister as well. He's really depressed and low, and we've noticed his memory's not so good. What can we do? We signed him up for Good Morning Selsey, started to give him a phone call. Got him signed up with the transport, so now he can get out. He comes to the men's group, and they enjoy a natter and a cup of tea. And also, then I had a call and they said he's improved so much now, but on the days that we don't go and see him, how can we help? I suggested they get the attendance allowance, and then they perhaps get a personal assistant to help them. So this is the variety of ways that we help. But as you can see, our numbers are growing, and so Karen's going to tell us a bit about the operations team.
So as a team, we were very aware that we needed to take stock of what was going on at the pace that we were going on at. So we stopped and took stock, and we identified 3 work streams to work that were based at the Selsey Care Shop. So that was Selsey Watch, Selsey Dementia Action Alliance, and Selsey Carers. So in order to ensure that the team were focused on their area of business, we met together and put together a SWOT analysis. We identified 4 areas of work to focus on. The overarching sort of vision statement for the Selsey Care Shop, and then the 3 underpinning missions for each area of work. We plan to develop the generic volunteer role descriptions and review our recruitment process. We're going to review our policies, procedures and processes, and we want to develop effective management processes, including monitoring and evaluating the quality assurance, and that will actually help us sort of embed what we're trying to achieve. This operational plan will also ensure that the underpinning foundations are sound. Our vision is clear, and we will be able to support sustainability as we grow and meet additional demand.
So just to sum up, there's a red book over there which we record or invite people to record their responses, so that we've got some qualitative evaluation. We pay them £5 for a very good entry and £3 for something less. But we also keep very careful quantitative analysis every day, and on average at the moment we have about 75 visitors a week and about 300 phone calls are entered into. We're investing in volunteers for the future because although we have robust fundraising and finance for this year, you can't rely on grants forever. And so we are not only getting about a third of our money now through fundraising events and activities, but trying to invest in the quality of volunteers to develop the future. And in the immediate future, we have to do something about this lady's workload, so we're sending her on a cruise for a couple of weeks and then doubling her numbers when she comes back. So thank you very much for your support and appreciation, and I think that's our presentation.
So nice to see the video. So I just wanted to ask if anybody had any questions. Mike was saying, well, Karen. Do you have a question?
Yeah. Is Selsey quite unique in this aspect of having a shop in the high street, the drop-in shop?
Well, there are clearly, as in Worthing, hubs
Yeah, but we don't have our own shop.
of various kinds.
Yeah.
I think Selsey, because it is an isolated place, 8 miles down a cul-de-sac, the truth is that if it doesn't happen locally, it doesn't happen. so we act as a conduit for agencies coming into work, and in a small community you build lots of relationships. So we jokingly say that we are going to get a cardboard cutout of Sue so that she can wave her hand to all the people who go past and smile and so on, and then they drop in, and we're now getting professional workers recommending that folk drop in or they're referred, and that's what's causing the growth. So we had 4 new people yesterday, and we're struggling to maintain the balance between supply and demand, and in that sense I suppose Selsey is unique because it's isolated. There's a strong community element, 140 community groups, and the fact that there's a one-stop shop where people build trust and confidence means that the demand simply keeps on growing.
I was just thinking, there are lots of rural areas in England, in the UK. Have you written up, have you thought of writing up and publishing what you've achieved?
Well, we're going to apply for another £5,000 to do that project when it is. No, seriously.
Laura's helping them with that.
Seriously, we I think, we always want to be modest about what's happening. I think that's important so that you keep your feet on the ground. But I think that we've had a number of people from the National Lottery and the County Council and various folk who've come and made films of the shop and publicised it. So whatever we've learned, we're keen to share. But as I hope I was honest enough in what I presented, we faced some pretty robust challenges on the journey, and we've met them and overcome them, and we're pressing on. Because none of these things are simple or easy, are they? No.
I think it's an important point though that you mentioned there, and one of the reasons, part of the reason for being part of this project is about having some help and support to learn and to enable people working across cancer institutes to share some of that learning, good and bad, what works and what doesn't work. There's so much to learn from both of those aspects.
Do you charge for your services?
No,
Sorry?
Do you charge for your services?
No, we get donations.
So you rely solely on donations and fundraising? We offer everything free of charge. As I say, about 1/3 of our income this year will come from business sponsorship, from shops who have a tin for us, donations, businesses who make us their charity of the year, that kind of thing. We're trying to be self-sustaining, but at the moment, and I think for the next 3 or 4 years, we shall have to rely on some grant income to maintain staff costs. Yeah.
I think the phone call in the morning sounds a fantastic initiative, and I'm surprised you actually only got 4 people who've taken that up, or do people not want to be a bother, or?
Some people with dementia though will not want a phone call because they've got carers going in already. These are particularly people who are living on their own, who get very lonely, so that call is coming in. And again, it's supply and demand. We call probably 25 people at the moment, and there's one person doing that phone call. We've got a volunteer who comes in on a Saturday, and it can take her from 9:30 through to 12:30 to do those 25 calls. But it's not just a wellbeing call, it's a chat, knowing about the cat and what's happening and all of those bits. So I'm now becoming very aware of the pressure that I'm putting on my colleagues in the Movies for Memories and for the morning calls, that I need to refer on appropriately, because otherwise we'll just outstrip the people that we've got to provide it.
One of the things we're trying to do across the west of the peninsula, in the Witterings and so on, is to replicate some of the services. So we're working with folk there to establish a good morning service in the west of the peninsula. And other things are developing there which we hope will complement what's happening in Selsey, and thus provide a bigger opportunity for people to receive, a phone call when they would find that helpful. But it's another one of those things that at the moment we have to manage the numbers, because the equipment in the shop won't allow us to have 2 people on the phone at the same time doing that service because of the other services that we're kind of offering.
It's a bit like with the men's group. I started off with 2 men, I've now got 10, they don't all come together, but I have to be aware that I've got 10 people that might come. So I've moved from my original place that started it, now the fire station trying to give the training room for me, but that's soon going to be outgrown as well. And it's all the logistics of getting people to the venue, making sure you've got enough volunteers that they're trained and can do it. So if one person goes to a group and really enjoys it, they're going to tell their friends, and that's where we're blossoming really.
That's great. Thank you.
Good.
Really great.